Good afternoon, everyone. Thanks for tuning in today. My name is Jeff. I'm from Brightsquid, and we're going to talk about work-life balance with SecureMail. With me today is Sunday Welsh from the Drumheller Associated Physicians. She's a clinic administrator there. Hi, Sunday. Thanks for joining us today.
Hi, thanks for having me.
Oh, our pleasure. And I also have Rohit Joshi, who's the Brightsquid CEO. And so we're going to talk about work-life balance with SecureMail. And Rohit, just before we dive right into it, what's your take on that? I mean, you founded Brightsquid, and seeing this as a tool that's being used for that, how does that come across for you?
Yeah, I think if we relate it to our non-healthcare lives, we've all gotten used to messaging offline or not synchronously, meaning that when it's convenient, I can answer an email. When it's convenient, I can send a message back to the person that's interested. And so there's a convenience in there, but there's also the sense that when I've got some downtime, I can pick it up, I can take care of business, and then go back to the rest of my world. And knowing what we've all been going through from a pandemic perspective, I think that's more important now than it ever has been, in understanding that we need to be able to turn on and turn off in order to find that balance. And I think secure mail and secure messaging in that way really does help it.
Yeah, great. Now Sunday, before we dive in too deep, we want to keep this conversation. We've got just a couple of short slides. We want to have some conversation at the end, answer your questions. There is a question tab in your GoToMeeting, GoToWebinar control panel. Feel free to type some questions in there, and we'll get to them as quickly as possible. So Sunday, you've been using SecureMail for a while in the clinic. Can you just tell us a bit about that? Sort of building on Rohit's comments, how does SecureMail fit into the clinic? You're obviously using it quite a lot. You're reaching out to the community. You've got a lot of users in the clinic who have SecureMail accounts. Can you tell me about that?
So when COVID hit, we found it very difficult to be able to manage our day-to-day clinical appointments. Lots of patients didn't want to come in, and many patients in our area are seniors, and so also aren't real computer savvy. And this just gave us an opportunity to be able to send some messaging back and forth to them. So that was the first step in us really starting to use our Brightsquid.
Yeah, and I mean, we can look at it and see the chart. And I know, Rohit, in terms of COVID-19, talk about some of the changes we've seen on our system since last April.
Yeah, it's been quite interesting to watch. We started the company in 2009, and I'm kind of chipping away and making small advances every year. And over the past 12 months, it's really, we can see the opportunity that we had always envisioned. Frankly, we'd always thought that it would have this opportunity, but then to see it actually happen in this dramatic time was pretty interesting. Since last year, we've increased messages from the physicians and the other people in the healthcare community, increased by about 100%. And from a patient perspective, the patient-sent messages have increased about 300%. And so, just to give you an idea of what that feels like, it took us about 9 years to get to our first million messages sent on our system. The second million messages, it took 2 years. So from 9 years to 2 years, and we'll hit the third millionth message in less than a year. And so it's been super interesting, is just in terms of how we're changing and adapting the healthcare system in order to provide the care that we know that's needed. Now, I think it's important for me to let you know that I grew up in Drumheller. And so from my perspective, I remember from a rural perspective, being able to communicate back with the clinic is not as simple as, driving 5 minutes. Sometimes it takes an hour to get to the doctor or more. And to have different ways of being able to address concerns becomes super, super important. So some of that thinking has clearly gone into it, even though I probably haven't haven't specifically said, this is the Drumheller feature. I got to tell you that stuff exists where rural Alberta needs to find different ways of working than where a patient and a clinic are separated by a 5-minute drive.
Yeah, and so someday, we're looking right now at some of your use cases. Can you talk about, I guess, building on that idea, you're predominantly, get a lot of rural patients, obviously. The use cases that you're doing with SecureMeld, can you talk about how those came about and how they fit into the practice?
Okay, so it is very interesting being in rural Alberta. Like Rohit said, that we do service a very large area. It's not just Drumheller. And what a lot of people don't know is that Drumheller has 3 different specialty types as well. And so we have patients that come from quite far, actually, in the rural area to come see these specialists. So it did enable the specialists more so to reach out to patients that weren't 5 minutes down the street. So that was a big factor as well. And then, of course, people trying to manage the working as well as seeing the physician. It's now enabled us to talk to them after hours. With the increase of different needs of forms because of the change with COVID and whatnot, we've had to use that to be able to even send patient information back and forth between their home and our home, just so we could complete the form rather than them coming back and forth to many different appointments and spending the time driving as well. So it's been very useful in a lot of different ways for us.
Sunday, I'm wondering, that one of the things that we've always wondered now is when we get over the pandemic, there's a lot of optimism with the vaccinations and so on. Do you see returning back to business as usual, or do you sort of see continuing to use and expand the use of virtual care tools, secure messaging, and other things?
No, we will definitely continue to use them. We found that with using them, it actually saves a lot of time for doctors as well. Like the physicians find that now they have less time spent collecting data in appointment time and letting us administratively collect the data for them, and then they can be a little bit more prepared for appointments. So it makes quite a difference actually for our practice, and I can't see the ones that are using it. I mean, we do have some older physicians who don't use any of the technologies as much, but any of the generation that definitely does, I can't ever see them changing how they're doing business now.
Yeah.
Great. Now, when we talked about it, we lost with the idea of work-life balance, and you and I spoke about this, back in December. Can you talk about how that works? This idea of care from anywhere. I know that you're not leaving the clinic behind, but with some of the challenges you talked about, people not being able to travel physically, you want to have distancing. How does that work for you, and what's been some of the upside of that?
So it's allowed the physicians to be able to work from anywhere, give us space so that they could still communicate with their patients and not all of them be in the clinic at once. Because, with 17 physicians and a primary care unit, that has, we have 4 nurses as well, just with them. And so bringing all the patients in and being able to social distance wasn't really, we couldn't do it. So this really gave us the benefit of being able to work from any place and to be able to adapt to time for patients as well.
And do you feel like it helps the clinic, because everybody, you've got a lot of accounts internally? Does it help with cohesion as a team? Does it bring people to sort of a central place to work together, or how does that fit?
Well, I would say it does because, like with having the shared box too, it allowed us that if the physician then was on ER call or anything like that, the patient replying wouldn't ever get missed. So it was. I find that it's very helpful to have the communication with as many of us that are, and we've been able to reach out to other practices. And communicate back and forth so that that handoff between physician to physician is also a little bit more manageable, because there's nothing worse than going to see a new physician and then you have to start over and you have to then tell them all the history and you think, why couldn't my information just transfer from place to place? So I think that it's really helped us there as well.
Yeah, I know that we're short of time. I feel like we could be talking, like I've got so many questions just in terms of the use of your actual workflow. When the pandemic hit, there's a lot of attention being paid to, video with your doctor. And I know that, that's not necessarily the preferred route. There has to be that triage opportunity for a clinic. And it sort of sounds like you guys have really leaned into that by getting the information ahead of the appointment and by reaching out after hours and all of that. And those are not necessarily good video opportunities, but certainly a good opportunity to deliver care.
Well, and we actually found that, well, we tried to use a video a lot at the beginning, thinking that was the direction we needed to go so that the physician could still have that good face-to-face. A lot of people didn't have video capabilities. So, and we didn't want to make them feel like they had to rush out and get that.
Yeah, and this goes back again to part of the thinking around, I think we need to find ways that bring healthcare closer in rural parts of the province, and I can tell you the video is a bit of a leap, and even though it sort of got a lot of the headlines during the early days of the pandemic, I think lots of people reverted back to phone and reverted back to secure messaging just to kind of get all of the appointments information even delivered. If I know that many of the patients, when we speak with doctors, they say, well, patients don't remember the instructions we delivered them when they were in the appointment. And so they're using secure messaging to kind of just say, okay, here's a recap. Here's all of that information. Here's the medication frequency, and here's what to watch for.
Yes, we find that we use that in that form as well, actually.
Oh, is that right? Okay, great.
Yeah.
And I think one of the interesting things that I think you, Sunday, were the first person to introduce me to this thought. And I since noticed at my own clinic, my doctor says to me, like, I don't have time in my day to handle all of the phone appointments I have, because they realized too that video was off the table for most of the stuff they have to do. And they do a ton of phone consults. And one of the things you said to me was, especially early on in COVID, sometimes a call with their doctor was the only social interaction patients had, and they tended to monopolize time. And so using secure mail instead helps physicians have more concise and to the point communications, that they don't get stuck on the phone for 20 minutes. Is that still the case?
Yes, we definitely find that it helps to allow them to manage their patient time so that everybody that is scheduled can be have the opportunity to have access to the physician, because definitely the phone calls did become a problem. You think it's a 15-minute phone call, and like I told you before, it turns into an hour easily. Well, then you have 20 more to make, and
Yep.
the time of the day goes by, and lots of people don't want to be on the phone with their physician at maybe 8 o'clock at night, right? But you need to be able to have access. So Brightsquid really did allow for us to be able to communicate back and forth with multiple patients in a much more timely fashion.
Yeah, that's great.
Jeff, I know we're running out of time. I know I was wondering if there's any questions that have shown up that we should be asking Sunday while we have her.
Yeah, we have a couple quick questions. One's a pretty quick one. Are you using the billing code? So people are asking about that for using secure mail as a consult. So there'll be like a 301S or any e-consults such as the 301R and things like that?
So yes, our physicians definitely have been using the billing codes. We have a billing company that actually handles our billing for our physicians. So what we do is we add into the day sheet the patient's name, and we made an appointment tab that says Brightsquid email, and so it's so that we make sure that they maximize their billing codes in that sense as well.
Awesome.
Great. And so one sort of big question that we get a lot, and this one came up too, obviously. What about patient overuse? Are you inundated with mountains of messages from patients in your secure mailing box?
So no, it's actually reasonable. We try to, so most of my physicians do not allow messages to come back to them directly. They manage it by having it come to us first. The only reason is just so that they don't get interrupted if they're in the middle of an emergent case. And if it's something that we can handle administratively, then it gets done right away and it doesn't happen to get prioritized way down and get missed potentially. So I think that we found as long as we use the shared box appropriately, then it helps with that.
Awesome.
Yeah, great. And I think one of the interesting things you brought to me was for your, I guess this is your OB who might have sort of urgent cases or high risk pregnancy cases that needed to be addressed. She can actually turn on that, like that's toggleable. She can turn on the ability for patients to message her over the weekend if need be, and then turn it off on Monday.
Yeah,
and that's something they need to do.
Yeah, so we have done that quite a bit for any of the maternity patients because they did need to have access, and things like that are unpredictable.
Totally.
Yeah, and I think so that as we're at our time, I just want to add one point to your comment around patients not being overly messaging. And Rohit talked about the stats, and patient use has grown by 300%. If you look at the stats, and in Alberta, there's 120,000 patients with secure mail accounts. And there are 7,000 healthcare professionals in Alberta with secure mail accounts. The number of messages sent, we're sending in Alberta about 95,000 messages a month. 3/4 of those messages come from those 7,000 professionals, and 25% of those messages come from those 120,000 patients. So you can get a sense. I think on average, if you do the math, our patients send about a message every 5 months. So absolutely, and then we get that your comments echo a lot of what we hear other places. So well, that brings us to our time. I don't want to get any longer. I know people have to finish up their lunch and get back to things. So Sunday, thank you again so much for giving us your time today. Really great to get your insights, and everybody else, thanks for tuning in. We will send out the recording so that so you can share this around with everybody else at your clinic. Any final words from Rohit or Sunday before we sign off?
From my perspective, thanks to everyone for tuning in, and Sunday, thanks so much for your time. I learn more just about how our system's used every time I talk to somebody, and it sounds like you guys have been using it in ways that we had predicted, but also in ways that we hadn't. So this is fantastic. Thanks for your time, Sunday.
All right, thank you for having us.
Thanks so much, everyone. Have a great weekend.